we're gonna look at the actual numbers of Ebola cases, not just the infections, but just the cases, suspicion of infection. If I'm not mistaken, the first, the first alarming situation was in New York, where I believe there were 6 people who were evaluated, and I think that number grew to like 22 people in New York. Then in Dallas, of course, Thomas Eric Duncan was infected. Then he infected nurse Nina Pham, and she then apparently infected nurse Amber Joy Vincent. Now, looking at the actual infections, you only have 3 people who were infected to this point, right? 3 people to this point that have been infected, and only one person has died. Now, if we round up all of the people that are involved with this virus, this deadly disease, as of October the 15th, there were 76 Texas Presbyterian Hospital healthcare workers who have been monitored because they had some level of contact with Thomas Duncan. That's 76 people. And then we include the 48 people that before he got into the hospital were sent away to be monitored. I believe there are 22 people in New York who were monitored. Then you had 48 people, but I believe only 10 people were monitored, right? So that's 32 people. Then you have 78 healthcare workers. That's 110 people that have been sent into isolation for monitoring. Now, at some point, you should know if they're infected or not. Now, I want to touch on the number 76 people who had some level of contact with Thomas Duncan. Remember, this is when he was infected. This is when he went to the hospital and was admitted for having the Ebola virus. 76 people? You're telling me 76 people came in contact with this person? Why do you even need 76 people to deal with that person? See, it's just to raise numbers. Just throw a big number out there to make it seem very scary. The level of concern, right? If you have 76 people, you would say, well, possibly a portion of these 76 people have been infected, so we have to do something about it. But to this day, there have only been 3 people that have been infected, and actually all of them are in question as how they got infected, even Thomas Eric Duncan. Now let me go once again over the timeline of how this occurred. Thomas Eric Duncan was from Monrovia, Liberia, a country among the hardest hit by Ebola. Duncan worked as a personal driver for the general manager of Safeway Cargo, a FedEx contractor in Liberia. According to manager Henry Brunson, Duncan abruptly quit his job on September the 4th, given no reason. Okay, he just quit his job with no reason. They asked him, why are you quitting? He didn't give any reason. Brunson added he knew Duncan had family in the United States and that Duncan's sister had come from the U.S. to visit him in the weeks before he quit. Now let me state that again. Brunson added he knew Duncan had family in the United States and that Duncan's sister had come from the U.S. to visit him in the weeks before he quit. Duncan was traveling on a visa when he made his first trip to the U.S. to reunite with his estranged teenage son and the boy's mother, Louise Troy, who had been his girlfriend in Liberia. But here's the thing. They're in America. Keep that in mind. On September the 15th, 2014, the family of Ebola patient Marthaline Williams were unable to summon an ambulance to transfer Williams to the hospital. Their tenant, Duncan, helped to transfer Williams by taxi to an Ebola treatment ward in Monrovia, Liberia. Duncan rode in the taxi to the treatment ward with Williams, her father, and her brother. The family was turned away due to lack of space, and Duncan helped carry Williams from the taxi back into her home, where she died shortly afterward. On September the 19th, Duncan went to the airport in Monrovia, where, according to Liberian officials, Duncan lied about his history of contact with the disease on an airport questionnaire before boarding a Brussels airline flight to Brussels. In Brussels, Duncan boarded United Airlines Flight 951 to Washington Dulles Airport. From Washington, he boarded United Airlines Flight 822 to Dallas-Fort Worth. He arrived in Dallas at 7:01 p.m. on September the 20th, 2014, and stayed with his partner and her five children, who live in the Fair Oaks neighborhood in Dallas. Duncan began experiencing symptoms on September the 24th and went to the Texas Health Presbyterian Hospital emergency room late in the evening of September the 25th. During the visit, the hospital reported his symptoms were a 101 fever, abdominal pain for 2 days, a headache, and decreased urination, but that he had had no vomit, diarrhea, or nausea at the time. The ER nurse had asked about his travel history and recorded he had come from Liberia. It was initially reported that this information was not relayed to the doctor by the hospital's electronic medical records system, but the hospital later retracted that statement. Hospital officials also said that Duncan had been asked if he had been around anyone who had been sick, and said Duncan told them he had not. He was diagnosed with a low-grade common viral disease and was sent home with a prescription of antibiotics. Now let me stop right quick. Now, Eric Duncan tried to help someone with Ebola. Why would he lie about coming in contact with someone with Ebola? Is he scared that he'll be sent away into a quarantine facility? What would he fear? Why would he lie about it? Why wouldn't he just say, I came in contact with someone who had Ebola. I was trying to help a young lady. The hospital turned her away because they ran out of space. So we brought her back to her home and there she died later. Why would he lie about that? Because that indicates that he is somewhat of a terrorist. He willingly came to this country knowing he came in contact with someone with Ebola and perhaps has Ebola himself, and he lied about it to potentially infect people in this country. This is what they're hinting at. That's what that means, really, when you say he lied about coming in contact with that young lady who had Ebola, because why would he lie about it if he's a genuine good person? He was trying to help someone with Ebola. Why would he lie about coming in contact with him? Did he foresee that the paranoia, the hysteria of being in contact with someone who had Ebola and then coming to America, that he would be sent away and quarantined and treated upon? Was he fearing that? Is that why he lied about it? I don't think he lied at all. I don't even think they asked him that, because they say the information was not relayed to the doctor by the hospital's electronic medical record system, but the hospital later retracted that statement. So apparently they had the information, but they turned him away. Duncan began vomiting on September the 28th and was transported the same day to the same Texas Health Presbyterian Hospital by ambulance. His Ebola diagnosis was confirmed during a CDC news conference on September the 30th, making Duncan the index patient for Ebola in the United States. Up to 100 people may have had contact with those who had direct contact with Duncan after he showed symptoms. Health officials later monitored 50 low and 10 high-risk contacts. The high-risk contacts being Duncan's close family members and 3 ambulance workers who took him to the hospital. Everyone who came into contact with Duncan is currently being monitored daily to watch for symptoms of the virus. The same day, a second person who had close contact with Duncan was put under close observation. On October the 3rd, Howard University Hospital announced they had placed a patient in isolation after he displayed Ebola-like symptoms and had recently traveled to Nigeria. But that patient was later ruled out of having Ebola. On October the 4th, 2 people earlier suspected of having Ebola were declared non-infected. Duncan was treated at Texas Health Presbyterian Hospital in Dallas. As of October the 4th, Duncan's condition had deteriorated from serious but stable to critical. Duncan was not given the experimental drug Z-Map, which was used to treat previous cases of Ebola in aid workers and medical staff, as stocks of the drug were depleted at the time of his infection, of course. American Ebola survivor Kent Brantley offered to donate his blood to Duncan. However, their blood types were incompatible. On October the 4th, Duncan began receiving the experimental drug Brasendifiver, which only received an FDA emergency investigational new drug authorization for Ebola treatment on October the 6th. Duncan was still in critical condition at the time. The next day, the CDC announced it had lost track of a homeless man who had been in the same ambulance as Duncan. They say the CDC announced it had lost track of a homeless man who had been in the same ambulance as Duncan. Oh, well, there's your Ebola continuation. That person is still running around infecting people. They lost track of him. They don't know where he's at. We have to find this homeless man. We don't know where this guy's at. They announced efforts were underway to locate the man and place him in a comfortable and compassionate monitoring environment. What the hell? Why do we feel the need to say comfortable and compassionate monitoring environment? This guy has Ebola. That's what you're saying? He has Ebola. Comfortable and compassionate monitoring environment. Later that day, the CDC announced that the man had been found and is being monitored. On October 7th, it was reported that Duncan's condition was improving. However, Duncan died at 7:51 a.m. on October 8, 2014, and became the first patient to die within the United States of the Ebola virus disease. What about the homeless man? They didn't go further talking about the homeless man. Anyway, Josephus Weeks, the nephew of Duncan, accused Texas Health Presbyterian Hospital of ignorance, incompetence, and indecency in the care of his uncle. Jesse Jackson also accused the hospital of discrimination. The hospital stated Duncan received the highest level of attention and care, regardless of nationality or ability to pay. Weeks claimed that Duncan told him that he never helped a pregnant woman, but that wait a minute. Weeks claims that Duncan told him that he never helped a pregnant woman, but that avoiding Ebola was indeed part of everyday life in West Africa, of course. So they say that he was in Liberia helping a young lady who had Ebola. But his nephew says that his uncle, Eric Duncan, told him he never helped a pregnant woman. The young lady was Marthaline Williams. She was 19 and she was pregnant, and apparently she was infected with the Ebola virus. He is telling his nephew, Josephus Weeks, that he never helped her. So if he never helped her, which was the primary source of his possible infection, then where did he get infected with the Ebola virus from, if not from her?